Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak to Dr. Kirsten Kohler, an Associate Professor of Environmental Health and Engineering at the Johns Hopkins Bloomberg School of Public Health. Dr. Kohler is an expert in air pollution, and we're talking about the massive forest fires on the West Coast of the United States and what they mean for our health. Let's listen. Dr. Kohler, thank you so much for joining me. These pictures of the fires on the West Coast are just incredible. And the pictures from San Francisco and other urban areas where the sky is practically blotted out are hard to believe. What are the air pollution issues and the risks to health right now?
So when you have fires, you can have a variety of pollutants being emitted. That can include, most importantly, particulate matter, which is what is leading to the degradation and visibility that you're seeing. But also increases in carbon monoxide and ozone can be observed as well. And for the particulate matter, we can have changes in particle sizes and chemical composition, including things like polycyclic aromatic hydrocarbons, which are known carcinogens that are produced through burning of this type of material in the forests. So we have all these different pollutants mixing into, in these cases, often very densely populated areas where large numbers of people are being exposed to really very high levels that we don't typically see in the United States.
So it's really like a toxic mix of chemicals.
Definitely a toxic mix. And we measure among the most important pollutants, PM 2.5 and PM 10, which are particles in the air that are smaller than either 2.5 or 10 microns. So these are very small particles that have the potential to be able to be inhaled and penetrate deep into the respiratory tract, interacting directly with the lungs.
And so what can they do? What's the damage they can do?
So when you breathe these particles, it can lead to a wide variety of health effects. And much more is known about how particles from just ambient air pollution impact our health, but there's growing evidence on how wildfires can impact our health as well. We know that exposure to these wildfire particles can be particularly problematic for people with respiratory diseases like COPD or asthma, and increase the morbidity for those people, increasing need for rescue medication use, for example, and making symptoms worse. But there's growing evidence that they may also have impacts on cardiovascular disease and all-cause mortality as well.
How long does it take for exposure to these chemicals to have a adverse effect on the body?
So we know that many of these types of health outcomes can happen pretty quickly. For example, an asthma attack can come on with exposures from just minutes to hours, potentially. Cardiovascular disease outcomes for ambient air pollution have also been shown to be correlated with exposures on the order of a day or two. So there's no reason to expect that the wildfire durations would need to be dramatically different than what we observe for ambient air pollution.
So you expect to see some health outcomes. You expect to see more asthma attacks, maybe even more heart attacks, other kinds of conditions just because of what's going on.
Yes, definitely. And particularly now we've had in some areas where air quality has been bad for approaching weeks, which is pretty unusual for wildfires that tend to be more often exposures for people on the order of days.
Can you give me a quantitative sense of what we're talking about? Like what's the usual particulates, or what measure would you use, and what are we dealing with now?
Sure. So for PM 2.5, the EPA recommends that, or requires that levels stay below 35 micrograms per cubic meter as a 24-hour average. And in most places in the United States, we do stay below that level. The worst days in places, say like the eastern suburbs of Los Angeles, might have a few days where the levels of PM 2.5 might be, say, 40 or 45 micrograms per meter cubed as a bad day. But what we're seeing right now, if I pull up airnow.gov, gives us estimates of the air quality in California and really extending up into Washington and Oregon also being quite bad. We're seeing levels of hundreds of micrograms per cubic meter.
So where the healthy level or the threshold level usually is 35, you're now seeing hundreds.
Yes. The worst value I'm seeing right now is over 800 micrograms per cubic meter in Eastern California.
Wow.
And that really rivals, if you think back to some of those really bad conditions that you've seen in Delhi and in Beijing over the last 10 years or so, that's rivaling those concentrations.
So what's someone to do? How do you protect yourself?
So in these situations, we'd really recommend that people stay indoors with their windows closed to the best of their ability. If you can operate a central air conditioning system, even if you don't run the air conditioning but just have the circulation on with good filters, that can help improve the air quality in your home. If you don't have access to that, you can also use in-room air purifier systems to help remove the particles as well. But you'll just want to look carefully at the specifications for the device and buy one that's properly sized for the unit, for the room that you intend to use it in.
I see. Is there some special filter you're supposed to use?
So for your home systems, the higher the MERV rating, MERV rating, the better it is. However, you should look at your system documentation because some systems aren't able to use the highest rated filters. They'll actually cause your system to not work efficiently. So buy the highest MERV rating filter that you can get for the system that's installed in your home.
What about wearing masks outside? Does that help?
So wearing masks outside can help. The types of masks that are made out of cloth that we use, that everybody's wearing right now for COVID, probably provide a relatively small amount of protection from these very small particles that tend to be from these fires, but may provide better than nothing. However, if you have access to something like the N95s that we hear people talking about, those would be better at reducing exposures.
Yeah, those are hard to wear, though, for long periods of time.
They are hard to wear. I mean, everybody's finding out that even just wearing your cloth masks are uncomfortable, and N95s are even more so uncomfortable.
So it's really a very difficult situation because for COVID, we're telling people to stay outside as much as possible, and now they can't do that in large parts of the country.
Right? We're telling people not to go to any of the normal places where they like to hang out, and now you can't even be in your backyard as well. So really forcing people to be kind of constrained to their own homes.
So there's a discussion about how unusual this is. Is this something that is going to become the new normal, or is this sort of a perfect storm of factors that we're going to have this big problem this year, but if we just do better forest management, et cetera, we won't see this in the future? Where do you fall in that discussion?
So I think the climate scientists are definitely showing that we expect to see the intensity and the frequency of these large fires becoming more frequent, as well as the duration of the fire season lasting longer through the year. So, you look over the last 10 years or so, the number of fires in the entire western half of the United States is increasing. And there's no real reason to think that that won't continue in continuing changing climate.
So what does that mean for preparation, not just for individuals, but for communities?
Yeah, I think fire management is not necessarily my area of expertise, but I think communities can also help be prepared, making sure everybody has evacuation plans in place, as well as maybe working on having clean air spaces where people can go that can provide highly filtered air for people who don't have access to that in their own homes.
Right. Hopefully when there's no pandemic.
Exactly.
Great. Anything else you think people need to know right now about the wildfires going on in the West Coast?
Yeah, I think people should continue to try to stay indoors as much as they can. A lot of these areas really do have air quality unlike we normally ever see in the United States. And it's a concern, particularly for people with pre-existing conditions, both respiratory conditions and cardiovascular disease, as well as there's evidence that older adults can also be more susceptible to the effects of air pollution. So if you're in one of those susceptible groups, really trying to limit your exposure to the best of your ability.
Let me ask you this last question, which is, we've seen the impact of this massive pollution all across the country now. Now that we're recording this here in Baltimore, it's a hazy day, and I'm reading that the haziness is because of the pollution coming from the wildfires on the West Coast. Number one, is that true? And number two, does it pose a threat to people even at this great distance?
Yeah, so this smoke can actually travel really far. And if you pull up the airnow.gov website, you can actually see the modeled extent of the fire. And it does, at this point, basically cover almost the entire United States, from down to well south of Washington, D.C., and basically the entire western half of the United States. It's basically showing everybody except southern Georgia and Alabama and Florida as being kind of within the plume of smoke that's coming. Not nearly to the extent of what people on the West Coast are seeing, obviously, but still.
But would you be able to measure differences in the air across the country?
So we can see that today is a somewhat more hazy day. If we looked at chemical composition, we might also see differences as well of having less impact of just the kind of traffic and industrial sources that we normally see contributing to PM 2.5, and probably more contribution of some of those chemicals more associated with forest fires.
Wow. Well, thank you so much for explaining this. I hope these fires stop as quick as possible. But I hear you that this is something we're going to need to expect and be really prepared for in the future.
Thanks for having me.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.